From your Gulf Coast weather authority, this is Fox 26 Morning News.
In HealthWorks this morning, gaining weight is a big concern over the holidays, and we all know why.
From turkey to tamales and loads of desserts. You know, there is a lot to choose from this time of year when you're getting together with family and or friends.
Sure is, but there's another health issue that you might want to think about before stuffing yourself this Christmas, and that is heart disease.
And joining us this morning, Dr. Kota Reddy, a Sugarland cardiologist. Good morning, and thank you for being here.
Thank you for inviting me.
Now, no one thinks in terms of their heart when they're going to someone's house and they see this big spread. You end up acting like a cow, grazing and grazing and grazing. But can that hurt you?
It definitely can, because the way we live in this country is we live as though we're going to live forever. But what do? We eat as though this is the last supper. Let's not make it a last supper. The point is, when you go to a party and when you see all these foods, what do you get? Sugar, starch, saturated fat. When you keep eating all the time, at least 4 to 5 hours, when you're at a party, you're always eating. And along with that, what do? You drink a lot of alcohol. What happens when you load upon fat and alcohol? With the next 4 to 5 hours, you're at the highest risk for having a heart attack. Now, have a big meal, get some alcohol in, and then go and smoke. That's even worse. That's a deadly trio. So the point is, if you want to eat, eat in moderation. Try a little bit. It's okay to starve. You don't have to load up. Why? Holidays are here. Same as heart attack. Why? Last 2 weeks of December and the first 2 weeks of January are the highest for heart attacks. There's a 35% increase incidence of heart disease. It's been shown that 65% of the first heart attacks, people who have it have no risk factors or one risk factor. And 50% of them who have the first heart attack drop dead. So the point is, why take the chance? If you have heart disease, don't overindulge. Stay on your medications. Stay away from foods.
Well, what foods in particular do you think that we should definitely stay away from?
I say usually 6 S's, but let's start with the first S, salt. The biggest culprit is salt. What happens when you eat something with salt? You retain fluid. When you retain fluid, what happens to your blood pressure? Goes up. When your blood pressure goes up, what happens to the heart? It's stressed. When the pressure in the heart goes up, it starts to backfill your lungs. Now you're drowning yourself in your own secretions. If you're over 65 and you eat a lot of salt, you go into heart failure. That's not good.
The tiniest little thing of salt is one of the deadliest.
Don't lick salt. Stay away from salt. Next is sugar. Go on, you had a question.
No. Keep on with the S's.
Yes.
Next is sugar. Sugar again, whenever you increase sugar intake, what happens to your blood sugar? Goes up. Triglycerides, what I call as the ugly cholesterol, they go up. When your triglycerides go up, you're at risk for pancreatitis. You're also at risk for heart disease. The other thing is alcohol. Alcohol is nothing but pure sugar. When you increase alcohol, what happens? You're at high risk for pancreatitis. That's extremely painful and could be fatal. Another one is holiday heart syndrome. Whenever you increase your alcohol intake, it can irritate the heart and you can put you in atrial fibrillation, what we call as irregular heartbeat. It's a very rapid heart rate. It can also put you at risk for strokes. So cut down the alcohol and sugar intake. The third one is fats, saturated fat and trans fats. They are the deadly ones. Saturated fat causes damage. In fact, if you have a big fatty meal, within the next 15 to 20 minutes, your arteries start to constrict. Your blood pressure goes up, your blood is thicker, and you're at high risk for strokes and heart attacks. The fourth S is stress, of course. Try to cut down the stress as much as possible. Why? It's been clearly shown. Chronic stress can increase your heart disease by 4 to 5-fold. Acute stress can put you in heart failure. There's one condition called stress-induced cardiomyopathy, mostly seen in women, postmenopausal. Intense stress can drop your heart function from 50 to 60%, which is normal, to 10 to 20%. You have chest tightness, go in with heart failure symptoms, look like you're having a heart attack, do an angiogram, the arteries are clean. But you do recover, but why go through all that? Then the fifth one is smoking. Cut the smoking out.
Dr. Kota Reddy, thank you so very much. Great information. So basically, we need to not graze as much as we would normally do. Thank you so very much.
Thank you
Happy
for
holidays and Happy New Year as well.
Great advice. I mean, we're talking about sugar, salt, alcohol, fatty foods, stress, and smoking. And, you know, those, at least the first three, that's big time when it comes to this holiday season.